Hello again. Now, the 7th Emerging Researcher Symposium is currently underway at the CSIR. It seeks to showcase the research work done by emerging researchers. One of the participants is Daniel Ndima. He spoke there passionately about the challenges posed by COVID. But on a positive note, he said the pandemic presented scientists with an opportunity to showcase how innovative they can get. Well, Daniel Ndima joins me now. He's the CEO of Cape Bio, an applied genomics and biotech company. The company received the green light, remember, to manufacture that rapid COVID-19 PCR test kits in the country. Pleasure and an honor to have you on today. Daniel, good afternoon, and thank you for joining us on today. How big an opportunity from a research perspective, the work that you do, has COVID-19 presented?
Thanks, Praten, for invitation. Good day to your viewers. You know, it's not a surprise that a country like ours is able to contribute positively to the response against this current pandemic because we have existing capabilities and expertise in the field. What we experienced was a bit of disorganization. And I think we managed to bring back, ourselves and say, we have to be ready as scientists, as innovators, and experts in the life science industry to innovate and ensure that our country does not beg for solutions that have to do with taking care of our health in the near future. So we've been privileged to be playing that role during the pandemic, and we believe we will continue to do so in the near future.
Were you around before the pandemic? Was Cape Bio around?
Yes, we existed before the pandemic, and our core business was just about producing these reagents, and exporting them to manufacturers that often assemble them and develop diagnostic kits, and they will be bringing those back to the continent. So the Department of Science Innovation, together with the DTIC and other stakeholders, then approached us to use this capability to contribute to the country's response at the time. So we have been around the block for some time. Mind you, we come from a research that was based at the CSIR between 2015 and 2018. So the capability was already developed then.
What was the main hurdle for you as you pivoted during the pandemic to do what you did, for example, with the PCR rapid test kits?
So, we are scientists, we are well-trained. I think we have demonstrated to the world that South African scientists are one of the best, and I can talk about a whole lot of people that contributed. So we knew how to develop this kind of high-tech, very sophisticated and complex technologies, but we have never actually produced them for the market to meet the industry standards. So we had to learn the regulatory environment, the requirements around these products, because any product that you use anywhere around the world that has to do, with testing, human beings, saving lives, has to have international standards. So we had to benchmark our capabilities with those that exist somewhere in America, in Europe, ensure that we've got the same quality product. So we had to learn, and that learning is what we're now using to respond holistically to the current challenges that are facing our country as far as reliance on imported products for HIV tests and among other diseases that we test every day in the country. We still heavily relying on importation. So we are here to make sure that we are able to contribute positively.
How do you characterize the size of your business, small, medium enterprise?
A small, medium enterprise. We have created quite a number of jobs, and we are still continuing to do so.
How many?
We have about 32 people now, and we're probably going to be closing to 40, but we have created over 70 jobs so far. And we recruit mostly young scientists that have expertise in the field that we operate in.
It must be difficult as a small, medium enterprise in this field, as you say, as you're an emerging researcher and you're a scientist in your own right and you're capable. It must be difficult on a number of fronts. One, maybe credibility. Some people might be doubting it because you're still building up your reputation, although you're a qualified scientist. Two, maybe some regulatory hurdles. I mean, in the health space, for example, there's many regulations and you might be battling with compliance. I don't know. You'll answer that question just now. And funding. Which ones have given you the biggest headache in Cape Bio?
I think for us, we have to be honest that the local market is still pretty much captured by the multinationals. It is very difficult to operate in the local space, but it's very easy for us to operate in the US. We've got distributors that side. And to be honest, that's the only challenge that we have. Innovation.
Hold on, Daniel. I just want to get you. You're finding it difficult to operate here with whatever you're producing, but easier in the American market, but not in your own home market. How's that?
I think that's a question that we have to probe more, because we spend billions of rands in supporting or procuring products from overseas, yet they are around the corner here in South Africa. And we were able to even support some of the SADC countries as they had access to some of our products. It is true. Funding, we're not really worried because we've been supported by the Eastquake Investments, who has been our investor since we launched the business. Innovation-wise, I think we have proven ourselves that we do match our counterparts around the world as we also partner them, as they also look into our IP and other resources that we produce, and as we do the same. So we have proven that we have built a company that can exist anywhere around the world.
You must have applied your minds to how would you break into the South African market in a way that is scalable for you and gives you the presence that you are getting in the US. What kind of things do you think would need to change to enable that?
Braden, SMMEs are at the heart of every economy around the world. They create millions of jobs, not because they are special or anything. It's simply because they come as a group and they are able to create these jobs. More importantly, they are supported in most of these countries so that they can create those jobs. If you don't support SMMEs, you will run a risk of having high employment rates because big corporates cannot absorb so many people. There are more opportunities we have, the more SMMEs coming to play a role, the more jobs we'll create, and we will reduce the social ills that we are seeing in the country. So, we play a pivotal role as a company in terms of our IP contribution to the world because we produce some of the best IP that is liked around the world. But the challenge has always been about how do we scale up ourselves so that we are able to support even more. The challenge is always about ensuring that the market is sufficiently, provided so that we are able to grow and even open other value chains so that more SMEs can start partnering with us and come to play a role in the economy.
Okay, finally, Daniel, I'm going to give you an opportunity to share with our viewers, what are you working on next? What's this next big thing, if there is such a thing currently, that Cape Bio is busy putting together? What are you, as your scientists there, busy trying to create for us?
I think, Brother, not to give our competitors an upper hand. But,
okay, you don't have to share. You don't have to share too much, but just give us an inkling that you are comfortable with, so your competitors don't run away with it.
We are looking holistically to the challenges that are facing South Africa as a country and the continent. Braden, your cost of accessing healthcare through your medical aid scheme and etc., seeing a doctor, they're quite high. And these are exacerbated by the reliance on importing products that actually test, what you have in your body. These are critical tools that safeguard lives. So we are looking holistically into South African needs, ensuring that we are responding, rapidly to ensure that at least somewhere next year we have a portfolio of products that are of assistance to our national health system.
I wish you all the success, you and your team there, and well done. You've created 70 jobs up to date, and you are breaking the mold, accessing the American market, which is very sophisticated and diverse, but you are battling to assist your home market. That's a little bit of a shame, but good luck with your efforts and all the best. That's Daniel Ndima. He's of